stand the pledge of allegiance. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, I get a chance to review the agenda. If so,
Did you want a roll call vote per
oh
attendance?
yeah, maybe check to see if everyone's still here or here.
Commissioner LaHaye,
Yes.
Commissioner Ludlow,
Yes.
Commissioner Bray. Here. Commissioner Kozlowski.
Here. It's close. So I'd look for a motion to adopt the agenda. If there's anything that anyone needs to add or pull from that.
I'll make a motion.
We have a motion by Commissioner LaHaye. A second. Support by Commissioner Ludlow. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Public comment. We have 3 minutes. Anyone in the room need public comment? Or on Zoom? From Zoom, nothing? Anybody? Is anybody even on Zoom? Okay. All right, we'll close public comment. The next item was Janelle. What did she say?
She's actually short staffed today and didn't want to leave her office unattended, but she just wanted to share the reimbursements from the state have still not come in. They're expecting them in December and said, quote, the bottom line is still holding and they're looking good still. So.
Okay. So you got her report. If no one has any questions, I'd look for a motion to receive and file her report. I make that motion.
I'll support it.
We have a motion and support. Any further discussion? If not, all those in favor signify by saying aye. Aye. Pose same sign. Received and filed her report. Next up, we have Chief Edmonds. 2025 ambulance schedule fee.
Good afternoon. So in discussing with our ambulance fee schedule with our contract with EMS billing provider, Mobile Health Resources, or MHR as we call them, it was suggested that we review and update our current fee schedule for the ambulance services we provide, remain current with allowable and approved fees. Newly approved rates were just provided to us at the end of October due to a new revised timeline by Blue Cross Blue Shield and Center for Medicare Medicaid Services. In the past, this adjustment had been requested to coincide with the city's fiscal year, as the newly published approved rates were not available until the new calendar year. Third-party insurers like Medicare, Medicaid, and Blue Cross establish allowable fees for ambulance services and publish those revisions annually as they change. By not adjusting our rates and underbilling, we're essentially using tax money to subsidize commercial insurers' profits and leaves us with less revenue to operate from. Any allowable increase assists in our long-term sustainability to provide key essential EMS services to the community for the future. Based on the annual revisions to allowable fees, I will be recommending the following ambulance rate increases for approval by the City Council to be effective January 1, 2025. And I have those proposed rates in that little spreadsheet there. Our interlocal ambulance agreement with Alpena County requires that we secure Alpena County's approval to raise ambulance fees by more than 5%. As none of these rate increases exceed the 5% allowable, I do not need to present the fee schedule to the full board of Alpena County Commissioners for approval before the effective implementation date. This document serves as notification that the proposed 2025 ambulance fee schedule will be presented for approval to go into effect January 1, 2025 at the Alpena City Council meeting. And actually I did change this document because we're actually presenting it this evening, November 18th, 2024 for council's approval.
Okay, so I got a couple questions. One of them, I know I went back when I was looking. So the last one we approved back in May 20th of 24.
Correct.
So if you have an increase, and you can tell me that I don't know why the reason that we approved a May 20th schedule increase, but I was thinking about it. If you propose 2 in a year, those 2 could exceed the 5%, and then what?
Good question, because we've never had that. So Medicare, Medicaid, Center for Medicare and Medicaid Services moved their timeline for when they roll out cost increases. And normally it's after the first of the year. This year it's in October. They changed it to October 31st. So basically it was suggested to us to make the changes effective January 1. So it also coincides with your calendar year for your fiscal year. So we've never had this before because we've never made that change.
So normally in the past, you've been doing it prior to the beginning of the city's fiscal year?
Correct. So normally what we would do is we put these changes in effect, July 1st is what we would do. So it coincides with the city's fiscal year. Now what we're gonna do is go to the calendar year, which will actually coincide with your fiscal year.
Okay. So we'll just make sure that we know that we're gonna be coinciding annually with our calendar.
So what'll happen in the future, John, is I'll probably make the request in November like I did this time to go in effect with January 1 of that next calendar year,
Okay.
or your fiscal year in that case.
And then the other question that I had, so it just seemed kind of funny that almost why even bother, but with advanced life support one, you went up an increase of 5 cents.
Correct. Because that was the allowable amount that we could go up to.
That's,
The billing agency recommends that we do it whenever there's an adjustment, we make the adjustments. We're not doing catch up at some point in time later. Because we've been in that problem before. I believe 2 times ago we did it and it was almost 20% on one of the increases because we hadn't made those increases.
you know, I would think just 5 cents, it's like almost that, like you said, is 0.007%. So I don't think you're gonna have to worry about exceeding the 5% there.
I have a question, John. On the ambulance fees, when you bill, how much of that do you have to write off every year?
It depends. So the collection company, actually Mobile Health Resources works on the collections for us. I could get you a better answer for the December meeting if you want and give you an idea how much we actually write off. We actually have a very high collection rate. We're about 82%, I believe, on our collections.
So that, I guess that's okay.
Yes, that's actually pretty good. We have a lot of people that are no pays, so that don't have insurance.
Now, if Medicaid pays you, they pay you the full amount?
No, no. It's a
They only
reduced
pay you
rate.
partial,
Yeah,
right?
they tell us what we're gonna receive, not what we want to receive.
Yeah. And the Medicare is the same way?
Medicare is a little bit better payoff, but they don't give us a full rate either.
But most people have a supplement insurance, so
Correct.
that help.
That usually picks it up.
Okay,
Correct.
all right, good.
So I have a note and I'm gonna just ask. So one of the things I made a note of is, so the amount of money that you collect for providing the service,
Yep.
is that available to anybody? So could the county see what you take in? Is
Sure.
there, where is that?
That's actually on the city's website.
So you actually,
They actually have it in their budget. Yeah. We bring in about 1.3 million is what we bring in. That's the most that we bring in. This year, we're probably gonna fall short of that.
how is it broken down?
Ambulance
Bill?
revenue. Yeah, it's broken down as the ambulance revenue.
Would it be possible, I'm sure you know better where to find it than I would, but would you be able to send it just out of curiosity?
Absolutely. Yes.
Okay. Does anybody else have any other questions?
I'm good.
Okay, so with that, I'd look for a motion to approve the 2025 ambulance fee schedule as presented.
I thought we don't have to approve it, though. We have to
Yeah,
approve
we
his
do.
submission of it, or?
So because of, well,
You can accept and file. if you'd like.
yeah,
If it was 5% or more, then I would need your permission
Right.
in order to do this.
That's what I-
Since it's less than 5%, basically, we're just notifying you, we're gonna make these changes in
okay,
Correct, that's what I was thinking.
okay. So look for a motion to receive and file that then.
I will make a motion.
So we have a motion by Commissioner Bray. I'll support by Commissioner Ludlow. Any other questions? If not, all those in favor signify by saying aye.
Aye.
Approve or against, the same sign. Motion passed. Okay, the next item is for the renewal agreement for legal representation with our Flora Boyda PLC for the family division for the January 1, 2025 through December 36 or December 31, 2026 in the amount of 3,800 per month. The contract was attached. I take it you're,
Nat Voitis,
okay. The only person I didn't recognize, so I'm assuming you were him.
that's me. And I'm here just to answer any questions you may have. Last year or thereabouts, we've had the contract for probate matters. For assigned matters for probate, so guardianships, mental health cases, those sorts of things. And we've obviously approved to continue on for 2 years, and we're asking you to do the same.
And I think, was it him? I don't know. All the others were at the same time, correct?
We had him, so what happened was, Mr. Voda agreed to take on the contract. I believe that opened up for some reason. He wanted to make sure that his firm could handle the caseload before he committed himself to a 3-year period. We agreed to do a 1-year period. If he felt that he could confidently continue the work, he would then continue on for the 2-year period so that when he comes up, it'll be when everybody else is up. It brings him back to that schedule.
Okay,
And the cost and everything is same, so we should be good. The only item I had on here was under scope, if we could strike Part D of subsection D of Part A, just for redundancy.
I don't have it in front of me.
Oh, I'm sorry. It says guardianship proceedings twice. So I just thought we'd strike, it's minor, but
If
yeah.
it's a mere redundancy, I have no objection to that.
any questions for Mr. Boyda? Okay, so I'd look for a motion to approve the contract with him through 2026, December of 2026.
I'll make the motion.
Motion by Commissioner LaHaye,
I'll support it.
support by Commissioner Bray. Any other discussion? Could we just get a roll call on that one?
Commissioner LaHaye,
Yes.
Commissioner Ludlow,
Yes.
Commissioner Bray,
Yes.
Commissioner Kozlowski.
Yes. Okay, thank you. Okay, next up, we have Kim, 911 Director.
Good afternoon. I have a couple small things for you today for an update. The first one, I received communication on the completion of our hazard material performance grant that we submit every year to Homeland Security. This year, we will be receiving a reimbursement in the amount of $1,241 from the state and the feds for the activities that we did through our LEPC meeting. That is $30.80 more than we were expecting. A lot. I can tell you that our equipment for our new 911 phone handling equipment has arrived. We received 12 boxes the other day, and we received a 750-pound crate today with the computer rack in it. So Ogama is the first partner being installed. They're supposed to be going live this week. And Oscoda County will be next, and then we'll be next after that. So I'm hoping by the end of the year, but if not by the end of the year, we should be switching over in January. We're very pleased. The customer service with our current vendor is lacking, and we actually are having problems with one of our stations currently, and we're having issues getting the replacement parts. So we're actually working one station short right now. So we're really anxious to move on to a different vendor and look forward to better customer service from them. Oops, sorry. Our dispatchers have completed the help time that they were offering to Roscommon County. Roscommon is fully functioning on their own now. They showed appreciation. They filled a giant gift basket with snacks and treats and things and sent up for our team, showing their appreciation. So we were really excited to be able to help them over that hurdle, particularly with them being our backup station. One other little pot of money, you may have heard Commissioner Peterson question me at Finance. We've been contacted by FEMA of the COVID reimbursements that we sought. We received a little over $1 million in reimbursement on that. Of those of us who worked on those reimbursements, Commissioner Peterson and I are the only ones still engineer that worked on it. So fortunately, I have the digital records to be able to apply for this. It's only $756. But we received a $15,000 reimbursement from FEMA. On that 15,000, we can now claim administrative and management costs for that. And I have all the records regarding the different webinars and the workshops and things that we did to become familiar with that opportunity so that we could take advantage of that. So I have all the records we need. FEMA has to back our project up in their system a couple of steps so that I can access it to add this to it. But I'm just waiting to hear back from them that they've completed that. And I will be submitting those documents and requesting that $756 that we didn't know we were entitled to. Other than that, you're pretty much up to date. Unless you have any questions for me.
Questions? Okay, thank you, Kim.
If we take anything we can take, get.
Yep. So the next item is the ambulance fund monthly report. And I did have questions on this, but I did ask the clerk's office. Question that I had, actually, so the question that I had was the 6,750 that was for last month, which I kind of figured it was, but it was the reimbursement of the different townships that their people went through. The only question that I have on that is per the and I know this isn't really you, but per the contract, it states that upon successful completion of the course and state licensure, the local government, which will be us, may request, or actually it's the townships, the local government may request reimbursement for from the county for using the county ambulance funds for reimbursement. And then the next line down, and this was actually the most recent amended contract, that we wouldn't reimburse their personnel until after 1 year of continuous service. So I don't know, because I guess Kerry told me that they recut those checks because apparently the checks got sent out to the city and then the city brought them back to us and then they reissued them to the townships. So I don't know what's your thoughts on that, Jesse?
I can get with them and look into it. Yeah.
So but I don't know, was it
It has-
townships that did they reach out to you, Kim?
There were some issues with how it was done this year, where it used to be, I think the townships would come directly to us. And then I think there was some miscommunication on whether the city would collect the proof of payment or whatever. We would just give it to the city and the city would disperse it. But then it turned out that no, it was that they would collect the proof for the invoices and turn it to us, but then we'd have to pay the townships directly. So it was just some miscommunication, I think, between the departments because it was done a little bit differently than.
Yeah, so we
previous
did it a
years.
little bit differently this time in that what I did is instead of you guys having 5 fire chiefs come in, make the request, I did the request on their behalf.
Yeah.
The intent is that you guys would pay those townships directly. We'd give you all the documentation that they paid.
Okay,
And what happened was that, yes, like you
Yeah.
said, it got miscommunicated that the city would get paid and then pay those out. That's not what we did. So
but so.
we're trying to streamline it for you.
So, but in this case, though, we paid, obviously, probably prior to the 1 year, did they all have a state license then?
I believe they all do. I don't know that for a fact. I know that when we had originally talked with Mary Catherine on it, I thought that there was policy change on the request because they didn't have to be for the year that they had to actually be with the departments. Because the departments are basically putting out the money.
Yeah.
Regardless whether or not somebody stays or not. And that's why the money was requested.
And I've been in touch with Anna, and I think you've been on those email chains just basically to start preparing us for next time around so that we can kind of avoid these hiccups. But one of those things I can add on here definitely is to make sure that we have copies of the licenses on file.
So then the part of the contract that is, we wouldn't reimburse prior to 1 year of continuous service.
Since I'm not the one cutting the check, I'll tell you what the townships would like to see is to get paid for those students for their tuition, because whether or not they get a license, they're still getting trained to do that, whether or not they stay with the department for a year or not. Those departments, you take one department alone was out, I think, 4 people. I think Long Rapids had 4 people at $750 a person. So you're talking almost $3,000 that they gotta sit on for a year. Most of their budgets are not $10,000 for the year. So that eats up a major part of their budgets. I was under the impression that the language somewhere, whether it was in the purchasing policy or it was in that contract, was allowed so that they could collect that reimbursement for the tuition.
I think, because I saw all and Kim gave them to me, but I left those in my car, I think. So I think there was 2, and I don't remember which ones, 2 that were paid 7 for 3 students at $22.50, and then I think there was several that paid $7.50.
Yeah, there's 5 departments, I think, total.
Yeah.
Chairman, can I ask a quick question?
Yeah.
So, do these townships tend to have turnover once these individuals are licensed? I mean, it's not high enough though to be notable or?
Not high enough to be notable. Really what we're looking at too, and again, it's a matter of whether or not you guys want to change policy or even the contract language for it, is everybody that we can get trained as a medical first responder, if they're helping someplace in the community, maybe it's not with my individual department, but they choose to go to your department in the county, which is generally what happens. It's a matter of that department collecting that money that they put out for it. And right now, honestly, there's a huge EMS shortage in the state of Michigan. You know, we're well over 1,000 providers that we're short of. So this does help feed that into it. And if people have an interest, a lot of times they're going into an EMT or even a paramedic program where they get continued employment.
Well, my issue is that because I read the contract and what the contract says is what I would think that we would follow. And I know we have a lot of different areas where we have policies and different things, policies and procedures. And I think, why do we have a policy and procedure or contract if we're not following it? So either we adjust this, I mean, because we've already paid it. So at this point, we can't do anything about it. Unless they want to send us the money back and then we wait a year. But I don't think they're going to do that. So either we need to, which I guess for Thursday meeting,
We can make an adjustment if you want.
I mean, I'd have to look at, because this is the most recent one, which was amended in 23.
And again, when I made the request, John, Mary Catherine was still here when we started it. And that was the intent of what we're doing if any policy changes were made within Alpena County, that I don't know.
Well, I'm not even saying the policies, but just if we're going to follow the contract, we would say we shouldn't have paid this because the contract says this. I get what you're saying is, you know, if there's still, you're providing the training to the individuals. And I know it's been in there for a while that, you know, we wait a year, but I don't know what the reasoning was to wait a year. I think probably because we wanted to make sure that those individuals stayed with the town or the townships, but like you said, either way, the townships have already paid for that training, whether they move out of the township or whatever. Okay. But I guess then the other piece to this is, do we get a copy of the state license for those individuals? Do we need that? Does the county need that?
That would be totally up to you guys.
What do you think?
I think it wouldn't hurt that.
And how long does it take to get a license back from and again, you know better than us.
Right.
So you train the person goes to the state to get a license.
Yep.
And then,
Normally they have their license, it's digital now, so they would have it within a week. They should have it within a week.
do they get a paper copy?
Yeah.
And how long would you say after the training, would they, one, I guess, take the test and then get
depends on the person. They have a year to be able to take that test. So most of them will test right away.
The only, I mean, I like that, but the problem is who's chasing this down? I mean, do we, and again, if the township's gonna remember, oh, hey, we just got this certification for whoever, we gotta send this to the, and then again, what are we doing with it once we have it?
I would say if the township has it, that should be sufficient, shouldn't it?
Township should have a copy of it.
Right.
Well, I
Or do
guess-
they prepay, I'm sorry,
Go ahead.
do they prepay for all their training and their testing?
Their testing and stuff, they pay at the time, once they have to complete the class.
Okay.
Once they've successfully passed the class, then they apply for the application to test.
Do they prepay for the class?
Yes,
The township or the
Township.
student?
the townships do.
The township.
So whether or not the student actually gets a license or not, it's a township that's really out.
What happens if a township, I mean, say someone, and I don't know, you would know again better than I would. If someone enrolls in the class and then decides halfway through or whatever they move or just are we paying for that then?
No, Green Township had one of those, because I think Green Township is the department that had 3 that are being reimbursed for. They had 4, but that gal about a month into the class had dropped out.
Okay,
They know that we did not submit for that individual because they did not complete the class.
so you would know that, like in this most recent case, and you were submitting on behalf of the town.
All of the, I think you have 10 applicants that you have their 10 tuitions that we had asked for reimbursement for the various townships. Every one of those successfully completed the class and were scheduled to take their state exams. So
Okay,
they were successful completion of the class.
Do you coordinate and oversee all of that?
there's 9 that because it was a total of 6750. Okay. So I guess that's another note to,
I included it.
okay, all right. So did anybody else have any questions on the ambulance fund reports?
No.
Okay, then I would look for a motion to receive and file the ambulance fund reports. Motion by Commissioner LaHaye,
I'll support it. Oh, sorry, go ahead.
If you don't mind.
support by Commissioner Bray. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carried.
So this question that we were just discussing, what are you actually doing? You're putting it towards Thursday's meeting?
Yeah, we have a meeting Thursday afternoon to discuss, outside of the board meeting, with the city to discuss the contract and put the final touches on it. Once that's done, then it'll go to the full board for review before your meeting in December, where we hope to approve it.
So you're going to like, couldn't have it,
We've been
Be in
bouncing
line?
back and
Okay.
forth on this.
And we've been volleying back and forth.
Yeah.
okay.
So, and
There,
how many months has it been?
since last January, I think.
Yeah, it's
When
been
we actually started.
So whatever you decide, you're gonna fix the contract to match.
Well, we'll just make tweaks to the contract. And again, if the stuff that we just discussed is not necessary or, it doesn't make sense, then why have it in the contract?
Right. And I think really what we're both trying to accomplish is to get in line with what we're currently best practices.
Yeah,
That's what we're looking at. So we can make adjustments.
okay.
Okay, so the next item we have is the Veterans Affairs Office Monthly Report. Do we know anything about that? Do you have any questions?
No, I don't have any questions. I'm on the Veterans Board. I'm not a veteran, but I'm on that board and they seem to have a pretty good operation there. And they've had their parade and everything on Veterans Day, came downtown. They did that, so. And everything as far as the money goes seems to be okay there. There's no deficits or anything like that.
So I was going through as I was getting ready for this and some of the things or a thing that jumped out at me was burials. So then I'm like, oh, that's quite a few 10. And I don't know what they do for burials. but I started going through the previous months. We have, seems like we have every month, like 10, around 10, maybe 8 is the average, but 8, 10 people that they're assisting for burial.
So I don't know how much that I can find out, how much they contribute to the burial or.
They do contribute quite a bit. There's a number of them and they do a ceremony and they do taps.
I think they do cremations, but I'm not sure about that.
Okay,
But I will find that out.
okay, just curious because
And
it just jumped out at me and then I highlighted it and I went back to the other ones, previous months. And it seemed like a lot of the previous months were 10, like, seems like a lot of people dying ever, I assume they're dying, that they're.
yeah, for the Miriam, they're dead.
Yeah, I hope so.
Well, the funeral homes will ask you if you want to have the veterans and they arrange it. So that's something that's done. And there's quite a few. If you're a service member, then
Yeah. So I guess I'd look for a motion to receive and file the veterans report.
I'll make that motion.
Motion by Commissioner Ludlow,
I'll support it.
support by Commissioner LaHaye. Any other discussion or any other questions? If not, all those in favor signify by saying aye.
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 Opposed, same sign. Motion approved. And what's next? That's it. Any other discussion? If not, I'd look for. Good.
I'll fix my glasses, sorry.
Look for motion. Our next meeting is actually on December 16th. I'd look for a motion to adjourn.
I'll make that motion.
Motion by Commissioner LaHaye,
I'll support.
supported by Commissioner Ray. All in favor signify by saying aye. Opposed, same sign, or adjourned.